So now we are going to test for any evidence of reduced arterial flow into the foot. In order to do this, we need to palpate the foot pulses. There are two foot pulses, main foot pulses, that enter the foot. There is the anterior tibial artery, which then forms the dorsalis artery, which runs along the dorsum of the foot, just adjacent to the first metatarsal. The second main artery comes down behind the medial side of the foot, behind the medial ankle bone, the medial malleolus, and then into the sole of the foot. That is the posterior tibial artery. And we palpate that just behind the medial malleolus. The best thing to do is to use two fingers to place them over the dorsum of the foot, on top of the artery, and feel for the pulse. And her dorsalis pedis pulse is right there. We are feeling, and when we feel, you'll soon feel whether or not it is a full bounding pulse. If it bounds and feels as if it's lifting your fingers off the patient's skin, so like that, then there is a good indication that this patient is maximally vasodilated and may have autonomic neuropathy. We then feel for the posterior tibial pulse, which is behind the medial malleolus. Once again, use the tips of your fingers, press in just behind the medial malleolus, release the tension on your fingers slightly, and there's the posterior tibial pulse. Remember, if you squash too hard, you can occlude the artery. If you press too lightly, you won't feel anything, particularly if there's any ankle edema. So that is palpating for the pedal arteries. The posterior tibial pulse behind the medial malleolus, the dorsalis pedis pulse, which comes from the anterior tibial artery and runs just adjacent to the first metatarsal, in line with the extensor tendon, which you can see demonstrated just here, just laterally to that.